Welcome to this month's CNA Monthly in Service. In this presentation, we will talk about the topics that surround mental health. Our agenda includes understanding mental health, types of mental health, understanding distress behaviors, level of crisis prevention model, approaches and preventative methods of crisis, and the importance of therapeutic rapport. So let's look at the definition of mental health. Mental health is a state of mental well-being that enables people to cope with the stresses of life. Mental health is a basic human right, and it is crucial to personal, community, and social economic development. Some factors that play a role in our mental health include individual psychological and biological factors, exposure to unfavorable social, economic, geopolitical, and environmental circumstances. The risks can manifest themselves at all stages of life, but those that occur during developmentally sensitive periods, especially early childhood, are particularly detrimental. Promotion and prevention of mental health. This diagram reflects how we think is how we feel. Circumstances. Things that happen in the world that we cannot control right now. Then there are thoughts. These are things that happen in your mind. These are the opinions and judgments we make about the circumstances. This causes feelings. Feelings are vibrations that happen in your body that are caused by your thoughts, not the circumstances. This can cause our actions. Actions is behavior. What we do in the world. Our actions are influenced by our feelings that are determined by our thoughts. Actions then bring about your results. What we see in the world and in our lives as an effect of our actions. Interestingly, the results will always be the evidence of your original thought. Our results can in some cases become our new circumstances. Promotion and prevention of mental health. There is no need to question thoughts that make you feel good. Good feelings lead to good actions, which lead to good results. This is a quote by Brooke Castillo. Practicing awareness of our own thoughts can change the outcomes of our actions. Helping others to focus on positive things can help improve their mental health. And practicing self-calming techniques can reduce both mental and physical stress levels. Understanding distress behaviors. We need to understand that all behavior is a form of communication. Distress behavior can be how a person communicates their distress. A person communicates distress through behavior. What does this mean for you as staff? How does this change your approach to challenging behavior? Trauma can change a person's brain. Frequent stress can also affect the brain's ability to dampen the stress response. Cognitive development is another factor. Managing emotions is a slowly developing skill. Mitigating risk. Preventative approaches we can take to reduce the risk of a severe outcome. We need to use a person-centered and trauma-informed approach to meet their wants and needs. We need to help the person strengthen their relationships with others and help the person develop some coping strategies, identify and reduce situations that triggers the distress. You may have to change the stimulus of the environment. An overstimulation can cause agitation. Next, we're going to go over some common types of mental health disorders. We'll talk about mood disorders, anxiety disorders, personality disorders, and psychotic disorders. A mood disorder is a disorder in which a person experiences long periods of extreme happiness, extreme sadness, or both. This can include depression, which can last weeks or months, and bipolar disorder involving severe mood swings or manias can last several weeks or even months. A person with a mood disorder may find it difficult to process what you're saying. Keep your instructions clear and simple and allow the person time to process what you have said. Anxiety. Anxiety is a normal part of life and usually passes with time. But for those with anxiety disorder, the dread doesn't stop, and it can get worse the longer it remains. People with anxiety disorders usually have recurring intrusive thoughts or concerns. A person with an anxiety disorder may challenge what staff are saying because it doesn't match their perception. So be careful not to dismiss people's feelings as unnatural or irrational. Set limits by giving the person choice and control. A personality disorder is a way of thinking, feeling, and behaving that differs from expectations of the culture, causes distress or problems functioning, and lasts over time. It can affect how the individual copes with life, manages relationships, and controls feelings or behavior. Someone with a personality disorder may use defensive behaviors to test staff to see if the rules, boundaries, and verbal limits will be implemented. Acknowledge differences in opinion rather than challenging the person. A psychotic disorder is a condition of the mind that results in difficulties determining what is real and not real. People with psychotic disorders may experience hallucinations and delusions. The most common type is schizophrenia. People who have this experience, hearing voices, see things that aren't there, or believe others are controlling their minds. Someone experiencing a psychotic episode may lack awareness of their condition and the impact of their beliefs and behavior on others. They may experience hallucinations and mistrust staff. Empathize with their experiences. Use clear words related to the here and now. What do behaviors at the anxiety level communicate? Distress that could be due to unmet needs, triggers in the environment, or factors in their life that may be out of your control. Some examples could be nervous movements, pacing, fidgeting, sighing, or shutting down. So how can you be supportive to a person at the anxiety level? Be supportive, be patient, listen, and convey empathy. Be non-judgmental. Focus on helping the person meet their needs and address the cause of their behavior. What do behaviors at the defensive level communicate? Distress that is more intense. They feel misunderstood, challenged, or threatened. Some examples of this could be shouting, refusal, asking challenging questions like, "Who are you to tell me what to do?" or acting in a threatening manner. What does it mean to provide clear directions? We want to use short, simple phrases that the person can follow. Give them simple and reasonable choices that help them consider positive behaviors and outcomes. Keep in mind, we still need to be supportive as we layer on a directive response. What does risk behavior communicate? Increased distress, where it is difficult for the person to express their emotions with words. So when it gets to this level, you'll see striking, throwing objects, pulling or pushing others, harming oneself, or what we call self-injurious behavior. Some safety interventions that we can use, we start with the non-restrictive. Non-restrictive interventions such as continuing supportive and directive interventions, making the environment safe, or moving to a place of safety. These could also include non-restrictive disengagements. For the restrictive interventions, this can be described as any physical, chemical, environmental, or mechanical intervention used to restrict a person's liberty of movement. This will always be the last resort. What does tension reduction communicate? The person is starting to regain some sense of calm and control. This is the best time to help them regain their composure or baseline behavior. So you may see some signs of relaxation in their posture, returning complexion or reduced muscle tension, maybe some emotional signs such as withdrawal, sadness, or embarrassment. So how can you provide therapeutic rapport when a person is at tension reduction? You need to address the needs of the person, support the person, and reestablish that relationship. Understand the incident and agree upon approaches for the future. This is not just for our residents, but with our staff as well. So here are some things we can do to provide therapeutic rapport. Supporting the present. What that does is help build relationships. It will bridge communication, establishes trust and relationships that are crucial in a future crisis. We need to understand the past. This allows the person to reflect on their actions, helps to uncover what happened, and identify any patterns and precipitating factors. Planning for the future results in learning and development of collaborating and problem solving. It also creates a sense of responsibility and ownership for the individual and helps staff prevent crisis behaviors and improve their approaches. So, in summary, therapeutic rapport provides necessary support. Support the individual and staff in the present, understand the incident, and plan for future interventions. Always follow your organization's policy and procedures, and notice effects of the incident on the person as well as on you. Take steps to minimize the impact and provide future support. Thank you for your participation in this training and your service to our individuals. After viewing, be sure to complete the test available at your worksite or your email. Turn the test in to your supervisor for grading and return to staff development. This concludes our in-service on mental health. Thank you.